Hi, I'm Michelle Burnler and I work for the Western Australian Association for Mental Health. As part of the NDIS Sector Readiness project, today we will be talking about reporting restrictive practices. Before we begin, I'd like to acknowledge the traditional custodians on the land of which this is being filmed, the Whadjuk people of the Noongar Nation. I pay my respects to elders past, present, and acknowledge that this is Aboriginal land that was never ceded. I also extend those respects to any Aboriginal or Torres Strait Islander people watching today. I would also like to acknowledge the courage and contribution of people with lived experience, whether that is lived experience of mental distress or of caring for someone with mental distress. Those with mental distress have shaped the way for us, and we really do stand on the shoulders of giants. I'd also like to acknowledge that the content we're covering today could be distressing for some people. If you find yourself going sideways or need to talk to someone afterwards, please contact Lifeline on 13 11 14. To recap from the last webinar, there are 5 types of restrictive practices: seclusion, chemical restraint, mechanical restraint, physical restraint, and environmental restraint. You will hear the terms regulated restrictive practice and authorised restrictive practice. Let's explore what the differences are. Regulated restrictive practice is defined by the NDIS Quality and Safeguarding Commission. There are 5 types, as mentioned previously, and there must be a behaviour support plan lodged by an implementing provider. That means that the provider must be a registered provider and registered to provide behaviour support. It is a national legislation, and so this is the same law that applies all across Australia. Authorised restrictive practice, on the other hand, refers to the local legislation. Here in WA, that is defined by the Department of Communities, and it is agreed to as a necessary act by a quality assurance panel. In this Navigating Safe Practices flowchart, we can understand how restrictive practices sit in the NDIS framework. The first question you need to ask yourself is it a prohibited practice? These include certain types of physical holds and things like response cost punishment strategies. If it is a prohibited practice, it needs to be ceased and reported immediately. The second question you need to ask yourself is it for therapeutic or medical reasons, a court order, or from non-intentional risk? This means that a therapist has signed off on it or a medical practitioner. A court order is an interesting document. If the court order defines that a restrictive practice must take place, then it is considered not a restrictive practice. If the court order alludes to but does not explicitly state that a restrictive practice must be used, it is considered a restrictive practice. An example of this is if the court order states that all doors must be locked to the house at 6 p.m. and not opened until 6 a.m. the next morning, it is not considered a restrictive practice. But if a court order simply says a curfew must be put in place from 6 p.m. to 6 a.m. and does not state explicitly that the doors must be locked, then it is a restrictive practice. This is a bit tricky and a bit of a grey area, but essentially you must follow what the court order says to a T. Non-intentional risk refers to when somebody may injure themselves or someone else or damage property, but not through a behaviour of concern, simply through an action that occurs. For example, if somebody exhibits arm flapping, they may accidentally hit themselves in the head or hurt someone else, but this isn't because of a behaviour of concern, this is because of an uncontrollable tic. If these are the case, then you need to check for a prescription by a medical or health practitioner and check that the person is consenting to this practice. If so, the practice can continue as it is not considered a restrictive practice. The final question you should ask yourself is it a regulated restrictive practice? So seclusion, mechanical restraint, physical restraint, environmental restraint, or chemical restraint? If so, has it been authorised in WA by a quality assurance panel in the last 12 months? If the answer is yes, the practice may continue with monthly reporting to the Quality and Safeguarding Commission and with an annual meeting of the Quality Assurance Panel to rediscuss if the restrictive practice is still needed. If the answer is no and it has not been approved by a Quality Assurance Panel, then you need to report the incident within 5 days to the Quality and Safeguarding Commission. You should then employ a positive behaviour support or PBS practitioner who will develop a behaviour support plan. A Quality Assurance Panel will then meet to discuss the restricted practices planned out within the plan, and if they find that these are not necessary, a new behaviour support plan needs to be created. If the plan is approved by the Quality Assurance Panel, the behaviour support plan then needs to be lodged with the Quality and Safeguarding Commission. Then you can continue with the action as long as you report monthly to the Quality and Safeguarding Commission and the Quality Assurance Panel continues to meet annually. This video from the NDIS Quality and Safeguarding Commission outlines what to do in the case of a reportable incident. Remember, an unauthorised or unregulated restrictive practice is considered a reportable incident and you must report within 5 days.
Hi, my name is Zeta and I'm the Acting Director for Reportable Incidents in New South Wales and ACT. The NDIS Quality and Safeguards Commission has an important role to play in improving the quality and safety of NDIS services and supports. Our role involves investigating and resolving problems. We also strengthen the skills and knowledge of providers and participants. This short video is the first in a series that explains important information on the key principles and requirements around the notification of reportable incidents. Future videos in this series will cover timeframes for notifying us and how to notify us of a reportable incident. Also, what to expect from the NDIS Commission. We recommend watching these videos in sequence to better your understanding. To safeguard people with disability from any incidents that have or could cause harm, we know prevention and mitigation are the most effective means of keeping them safe. So all NDIS providers must implement preventative practices such as implementing proactive risk management policies and procedures, informing people with disability about your incident management practices, and ensuring people with disability are accessing supports in a safe environment that is appropriate to their needs. So what is a reportable incident? Let me take you through the list. These are reportable incidents as defined by the NDIS Act. They include the death of a person with disability, serious injury of a person with disability, abuse or neglect of a person with disability, unlawful sexual or physical contact with or assault of a person with disability, sexual misconduct committed against or in the presence of a person with disability, including grooming of the person, the use of restrictive practice in relation to a person with disability that is not in accordance with a behaviour support plan, and the use of a restrictive practice in relation to a person with disability that is not in accordance with an authorisation, if any, required by the state or territory where it is being used. We know that reportable incidents can occur in a number of places where you are providing supports or services to persons with disability. More information on what these categories mean is located on our website. If you're a registered NDIS provider, you must notify us of a reportable incident that occurs or that is alleged to have occurred in connection with the supports and services you provide. All other incidents should be managed in accordance with your incident management system and procedures. We are here to help you understand and comply with your reportable incident obligations. Our website has extensive information and you can contact us on 1800 035 544. We hope that this video has been helpful. Our next video in the series will outline timeframes for notifying the NDIS Commission and how to notify us of a reportable incident. Thank you.
This resource, developed by WA Individualised Services, outlines what to do if you experience or witness a reportable incident. If you have difficulties reporting or you suspect that your manager has not reported a reportable incident, you are obliged under the Code of Conduct to report that incident. You can contact the WA Reportable Incidents team at this email or the National Unauthorised Restrictive Practices team at this email. For other support options, please consult your internal policies and procedures. We recommend that you access external supervision. The NDIS community and stakeholder meetings are held on the first Wednesday of the month and can be accessed by contacting the NDIA. There is a behaviour support community of practice held online on the second Thursday of the month, and we recommend you contact Anne Hood at Rise Network. Finally, the Department of Communities has a website dedicated to authorised restrictive practices. There are many free webinars and resources available. You can access the WAAMH NDIS Sector Legacy Toolbox on the Care Hub by scanning this QR code. Thank you for joining us for this webinar.